3 silent signs your body sends after eating that you're probably ignoring. Every year, 36 million Americans fall. And the most dangerous moment, the one almost nobody talks about, happens right after a meal. Not outside, not on icy sidewalks, right there at the kitchen table, when you push back your chair and stand up to clear the dishes. That moment has sent more people to my emergency department than most people would believe. But here's what makes this harder to talk about. The signs that something is quietly wrong don't feel dangerous. They feel ordinary. A little dizzy when you stand, a little tired after you eat, a dry cough that comes and goes. Most people over 60 chalk these up to aging. They push through it. They get up too fast. They walk it off. And sometimes that is the decision that changes everything. Over the course of my career in emergency medicine, I started noticing a pattern. It wasn't dramatic. It was quiet. People coming in with falls, with aspiration, pneumonia, with small strokes. And when you trace it back, the story almost always started the same way. A meal, the 30 minutes after, and a body that was trying to say something that nobody knew how to read. So in this video, I want to talk about 3 specific signals your body sends after every meal. 3 things that most people over 60 are experiencing and dismissing as nothing. I want to explain what's actually happening underneath each one, why it matters more than it looks, and exactly what to do about it starting today. I'm going to give you a practical framework you can use after every single meal. It takes minutes. It protects your brain, your lungs, and your ability to stay on your feet. And by the end, you'll understand why something as ordinary as eating lunch carries risks that almost nobody is teaching people about. Let's start with the sign that sits right on the surface and gets dismissed the most. Sign number 1, the dizziness you feel when you stand up after eating. There is a name for this, and it isn't just getting old. It's called postprandial hypotension, post-meal low blood pressure. And according to the National Institute on Aging, it affects roughly 1 in 3 adults over the age of 65. 1 in 3. That's an enormous number. And most of those people have no idea it has a name, a mechanism, and a set of things you can actually do about it. Here's what's happening. When food enters your stomach, your body treats digestion as a major operation. It diverts blood supply to your abdomen, to your stomach, your intestines, the whole system that breaks food down and absorbs nutrients. That diversion is real and significant. Several cups worth of blood shift toward your gut in the minutes after a meal. Now, in a younger body, that diversion is instantly compensated. The heart speeds up slightly, blood vessels in the legs tighten, your nervous system keeps the pressure balanced. The brain keeps getting what it needs, even as the digestive system gets its share. But after 60, those compensating reflexes slow down. The autonomic nervous system, the part of your nervous system that runs your blood pressure automatically, the way cruise control runs, your speed starts responding more sluggishly. It doesn't fail entirely. It just doesn't catch up as fast. Think of it like an irrigation system for a hillside farm. When water is plentiful, every field gets enough the valley floor and the field at the top of the slope. But when water is in short supply, the lower fields fill up first. The field at the top of the slope, the furthest from the pump, the hardest to reach, that one starts running dry. In your body, the brain is that top of the slope field. It's the furthest point from your heart, the hardest to supply, the most dependent on steady pressure. When blood shifts toward your gut after eating and your body can't compensate fast enough, the brain is the first place to feel it. And that's when you feel it. The slight graying of vision when you stand up, the moment of unsteadiness, the heaviness in your legs, the fog in your thinking. What most people do in that moment is push through it. Stand up anyway. Start walking. After all, moving around gets the blood going, right? Here's where this gets really important because that instinct is exactly backwards. When you start walking, your leg muscles wake up and demand blood of their own. Now you have your gut competing for blood, your legs competing for blood, and your brain is sitting there at the top of the hill waiting. The dizziness doesn't improve. In many cases, it gets worse. And that is when people lose their footing. One of the patients I think about from my years in the ER was Earl. He was 71, a retired mail carrier from Nashville. Spent 30 years on his feet, genuinely fit for his age. He'd been having post-meal dizziness for months and dealt with it the way he dealt with everything. He got up and walked it off. Brisk walk around the block after lunch every day. One afternoon, about half a block from his house, his knees buckled. He caught himself on a neighbor's fence, but just barely. He came in shaken, and we spent some time figuring out what was going on. The blood pressure reading we did right after he stood up compared to sitting told us most of the story. Earl's blood pressure was dropping more than 30 points when he stood up after eating. That's enough to starve the brain of what it needs for a few critical seconds, enough to make legs unreliable, enough to make a fall not just possible, but likely. The fix wasn't complicated. And I'll give it to you now, because this is something you could start using at your next meal. The most effective single thing you can do to reduce post-meal blood pressure drops is drink a full glass of water, a large glass, not a few sips, 15 to 30 minutes before you eat. Research published through the National Institute on Aging found that drinking approximately 16 ounces of water before a meal reduced the frequency and severity of postprandial blood pressure drops by nearly 1/3 in older adults. Not water with the meal, not water after, before. The mechanism is interesting. When a large amount of water enters your stomach quickly, the stomach wall stretches. That stretch activates pressure receptors that talk to your nervous system. The nervous system responds by tightening blood vessels, essentially bracing for activity. That tightening is still in place when food comes in and blood starts shifting toward digestion. It acts like a counterbalance. So the water isn't working because you're hydrated. It's working because you've given your nervous system a heads up. A couple of important notes. First, if your doctor has told you to limit fluids because of a heart condition or kidney disease, follow your doctor's instruction. Don't add fluids without that conversation. Second, sipping water slowly throughout the meal doesn't produce the same effect. You need the stomach to register a significant volume arriving at once. Drink it like you mean it, a full glass, before you sit down to eat. Beyond the water, there are 4 things about how you eat that change how badly your blood pressure drops afterward. The first is portion size. The more food that enters your stomach at once, the more blood your body diverts to deal with it. Eating smaller meals more frequently is more than just a weight management tip. It is directly protective against post-meal blood pressure drops. If eating 3 large meals is your habit, consider whether 2 of them could be split into smaller portions, eaten an hour apart. The second is the type of food. High carbohydrate meals, rice, bread, pasta, potatoes, trigger a more dramatic blood pressure response than meals higher in protein or vegetables. This doesn't mean you can't eat carbohydrates. It means if you're going to eat a large bowl of pasta, you might want to eat it earlier in the day when you're less likely to be alone afterward and when you have somewhere to sit for a while after. The third is temperature. Very hot foods and liquids cause blood vessels to dilate, to widen as your body tries to manage heat. Dilated vessels mean lower pressure. If you're someone who regularly experiences post-meal dizziness, letting hot soup cool for a few minutes before you eat it is not just a comfort thing. It's a real intervention. The fourth is alcohol. Even a single drink with a meal significantly amplifies the blood pressure drop that follows. If you're on blood pressure medication and you have a drink with dinner, You are combining two things that lower blood pressure in a body that is already redirecting blood flow away from your brain to digest food. That is a difficult combination. This is one of the reasons falls happen more at restaurant dinners and holiday gatherings, not just because of the alcohol, but because of the meal, the alcohol, and the standing up afterward. Now, and this is the belief disruption. I want you to stay with what should you actually do in the minutes right after eating. The standard advice most people grew up with is don't lie down after a meal. It's bad for you. Causes reflux, causes poor digestion. Don't do it. That advice, as a blanket rule, is wrong. And it has contributed to a generation of older adults sitting upright through post meal dizziness that could be easily managed. Here is the actual picture. Lying down after a meal in the right position is one of the most effective things a person over 60 can do to protect their brain in that vulnerable window. When you lie down, your heart and your brain are at approximately the same level. Your body no longer has to push blood uphill against gravity to reach your brain. The pressure reaches the brain more easily with less effort. The concern about lying down causing reflux is real, but it is a concern about position, not about lying down itself. If you lie flat on your back, stomach contents can come back up toward your throat. If you lie on your right side, the valve between your stomach and esophagus sits below the level of the stomach contents, and they can flow toward it. But if you lie on your left side specifically with your upper body slightly elevated, that valve rises above the level of the stomach contents. It's protected by position, and your brain gets the blood flow it needs without fighting gravity. Think of a half full teapot. If you tilt it so the spout points down, liquid flows toward the spout easily. Tilt it the other way, and the spout is now pointing up. Nothing comes out regardless of how much you shake it. Lying on your left side puts the stomach's exit valve in the spout pointing up position. That's what protects against reflux while still letting the brain benefit from the horizontal position. The right way to rest after a meal is this. Lie on your left side with your upper body elevated, propped on cushions or the back of the couch. So your torso is at roughly a 30 to 45 degree angle, not flat, not just a pillow under your head that only bends your neck and compresses your stomach. The whole upper body elevated, upper body angled, left side. Lie like that for 15 to 20 minutes after a bigger meal. And the post-meal dizziness that so many people over 60 experience every single day will, for most people, meaningfully improve. This brings me to the second sign, and this one is easier to miss because it sounds harmless. Sign number 2, the cough that starts after you eat or the throat that never quite clears. Most people who develop a persistent dry cough in their 60s or 70s spend months looking in the wrong direction. They check for allergies. They try antihistamines. They go to an ear, nose, and throat specialist. They get treated for acid reflux. And sometimes it is those things, but there's a category of post-meal cough that represents something different. And missing it can have serious consequences. Here's what I want you to think about. Your throat has 2 paths running through it, one for food and liquid, one for air. Every time you swallow, a small flap called the epiglottis closes over the airway like a lid, letting food pass safely down the esophagus. Then it opens again. This happens hundreds of times a day, thousands of times a week. When you're young, that lid snaps shut with speed and precision. The timing is tight. You can swallow and talk and eat quickly, and the system handles it. As you age, the muscles controlling that lid lose some of their speed and coordination. The timing drifts by fractions of a second. And in those fractions of a second, small amounts of food, liquid, or saliva slip past the lid and enter the airway. In a younger person, even a tiny amount of liquid in the airway triggers an immediate cough reflex, forceful, reflexive, hard to ignore. That cough expels what got in. But here's what changes after 60. The sensory nerve endings in the back of the throat become less sensitive. The system that detects something in the wrong place slows down. Material can enter the airway without triggering any cough at all. It slides into the lungs silently. You finish your meal, stand up, and feel completely fine. You have no idea anything went in. This is called silent aspiration, and it is far more common in older adults than most people know. The National Institute on Aging estimates that aspiration, food or liquid entering the airway, is responsible for a significant proportion of pneumonia cases in adults over 65. Aspiration pneumonia is the most common cause of pneumonia death in this age group. And the most dangerous form is the silent kind, where you never feel anything going in, so you never know there's a problem until the fever starts. A patient I saw several years ago, Dorothy, 68, a retired school teacher from Pittsburgh, had been managing a dry cough for 4 months. She'd been told it was seasonal allergies. Then that the reflux medication wasn't working right. No one had asked the right question. When I saw her, I asked, does the cough start after meals? Does water sometimes feel like it goes down wrong? Does your voice get slightly hoarse or wet sounding right after you swallow? She stopped. How did you know that? Dorothy had been aspirating small amounts of saliva and liquid during every meal for months. By the time she came in, there was already a developing infection in the lower lobe of her right lung. She spent 8 days in the hospital. The signs were there. She just didn't know what to look for. Here is what I want you to check right now for yourself or someone you care about. Does coughing happen during or right after eating rather than at random times throughout the day? When you swallow water or thin liquids, does it sometimes feel like it goes the wrong way more often than it used to? Right after you swallow something, does your voice sound different, wetter, more gravelly, like something is coating your throat? Does your throat feel like something is stuck in it after meals, even when you've clearly finished swallowing? Has the time it takes you to eat a full meal noticeably increased over the past year or two, not because you're being careful, but because swallowing just takes longer? Any of these, especially if they're new or worsening, is worth bringing to your primary care doctor. There's a simple evaluation, a swallowing study, that can identify whether aspiration is happening and how severe it is. This is not a reason to panic. It is a reason to ask. There are also things you can do right now that reduce aspiration risk at every meal. The first is chin tuck. When you swallow, gently tuck your chin toward your chest, a small, deliberate nod. This narrows the entrance to the airway and gives the epiglottis a better mechanical advantage. In swallowing rehabilitation, the chin tuck is taught specifically because it reduces aspiration. You don't need a therapist to use it. Just remember, every swallow, small nod down. The second is slow down and take smaller bites or sips. When your mouth is partially full and you add more before the first amount is fully swallowed, the excess slides toward the back of your throat before the airway can close properly. One bite, full swallow, pause, then the next. This single habit reduces aspiration risk significantly in people with early swallowing changes. The third, don't eat and talk at the same time. Talking requires the airway to open. If food is moving through your throat at the same moment you're speaking, you are asking the system to have the airway open and closed simultaneously. For a young person with fast reflexes, this mostly works out. After 60, the margin of error shrinks. The fourth, stay upright for at least 30 minutes after eating before you lie down. Even if you're going to use the left side resting position, I described wait 30 minutes first, especially if your last meal was large. Let your stomach empty enough that the volume of material at risk is smaller. And critically, Brush your teeth and tongue before bed every night. This is not just dental hygiene. Oral bacteria, the bacteria naturally present in your mouth, are what turn an aspiration event into aspiration pneumonia. Liquid that enters the airway is not by itself always enough to cause pneumonia. Liquid carrying a heavy load of bacteria is a different matter. A clean mouth at bedtime is one of the most protective things an older adult can do. If you use dentures, clean them every single day. Bacteria colonize denture surfaces just as they colonize tooth surfaces. There's also a specific swallowing exercise that strengthens the muscles involved in closing the airway. Roll up a small towel about the diameter of a toilet paper roll and place it under your chin. Then press your chin down hard against the towel as if you're trying to compress it. Hold for 5 seconds. Release. Repeat 10 times. Do this once a day while watching television. The muscle you're working is the one that pulls the larynx upward and forward when you swallow, which is exactly the action that closes the airway lid over the airway. Keeping that muscle strong directly reduces how much material slips past when you swallow. It sounds almost too simple. It is that simple. And the research supporting it from programs developed at Johns Hopkins and elsewhere is solid. This brings me to the third sign, and this one is arguably the most acutely dangerous because it happens in a matter of seconds and the consequences of getting it wrong are immediate. Sign number 3, the leg weakness when you stand up from the table. Of all the things I want you to take from this video, this might be the most important for the next time you eat a meal. Standing up from a seated position is, under normal circumstances, a seamlessly managed event. Blood vessels tighten, the heart adjusts, pressure stays consistent, you stand up, and you're fine. But after 60, and especially after a meal, when your blood pressure is already somewhat lower than usual because of digestion, that transition can fail. Blood pools in your legs. Your brain gets less than it needs for a few critical seconds. You feel it as heaviness in the legs, a sudden weakness, a graying at the edges of your vision. The CDC reports that falls are the leading cause of both injury and injury-related death in adults over 65. About 36 million falls occur annually. 3 million of those result in emergency department visits. Approximately a quarter of all hip fractures occur in the year following a previous fall. And here's what the statistics don't always show clearly. A meaningful proportion of these falls happen inside the home in ordinary moments, not during outdoor activities or dramatic accidents. They happen in the kitchen, at the bathroom door, at the side of the bed. The post-meal standing moment is one of the highest risk windows of the day for older adults, particularly those on blood pressure medications, which lower baseline pressure further, or those with diabetes, which affects the autonomic nervous system's ability to compensate. Here's what I want you to know about the mechanics of that dangerous moment. And then I want to give you something you can practice right now that works. Let me ask you something first. Have you ever stood up from the dinner table and felt your legs go heavy just for a second, like they weren't quite yours yet? That's not a random sensation. That's a message. When you've been sitting after a meal and you stand up, blood moves toward your legs under the influence of gravity. Fast. More than you'd expect. For your circulation to compensate, your blood vessels need to squeeze that blood back upward. That squeezing depends on your autonomic nervous system acting quickly. After a large meal, your autonomic system is partly occupied directing blood toward digestion. Its capacity to simultaneously manage the postural transition is reduced. The result? Your brain runs short for a few critical seconds. But here's what's important, and this is the part most doctors never teach. You can help it manually without medication, without equipment, right there at the table. Your leg muscles, when contracted, physically compress the blood vessels running through them. Squeeze the muscle, and you squeeze the vessel, and blood gets pushed upward toward the heart, then toward the brain. This isn't your autonomic nervous system doing the work, it's you manually assisting. Imagine a long, flexible tube lying on the floor, full of water, just lying there. Water pools at the lowest point by gravity. Now grab the tube in both hands and squeeze it, the water shoots upward. That's exactly what happens when you contract your leg muscles during a moment of blood pressure drop. This technique is used clinically in cardiology and neurology to manage orthostatic hypotension, the medical term for blood pressure that drops when you stand. And it works if you feel dizziness coming on as you stand or in the moment right after you stand. Do this. Cross one foot in front of the other like a scissors position and press your legs against each other firmly. Simultaneously, tighten your thighs, your glutes, and your core. Hold that for 15 to 30 seconds. If crossing your legs feels unsteady, stand with both feet on the floor. Press your thighs together as tightly as you can and tighten your core. The effect is similar. At the same time, make both hands into fists. Squeeze hard. The muscle contractions in your arms and hands add to the pressure being pushed upward. Research published in the journal Circulation found that physical counterpressure maneuvers, precisely these kinds of muscle contractions, can raise systolic blood pressure by 15 to 20 millimeters of mercury within seconds in people experiencing orthostatic hypotension. That is often enough to prevent a loss of consciousness or a fall. The reason most people don't do this in a moment of dizziness is that they haven't practiced it beforehand. The dizziness hits, and the reflex is to either freeze or walk. Walking, as I've explained, makes things worse. The squeeze response only becomes automatic if you've rehearsed it when you weren't dizzy. So here is what I'd encourage you to do. Twice a day, when you're brushing your teeth in the morning and at night, practice the leg squeeze. Stand in front of the mirror, cross your legs, tighten everything from the waist down, hold for 30 seconds. Do this every day for 2 weeks, and the movement will become automatic enough that when you actually need it, your body knows what to do. If you feel a more severe episode vision, truly going gray, legs giving way, the right response is to get down, not to try to reach a chair, not to take steps. Get your body closer to the floor by crouching or sit down right where you are. Then lie flat on your back and put your legs up against a wall or a chair seat. Gravity does the rest. Blood in the legs flows back toward the heart and brain almost immediately. This is the fastest recovery position available. But I want to add something here, because the standing up moment is not actually the only dangerous moment. There is a sequence of actions that leads up to it, and protecting that sequence protects everything. The way you get up from a lying position or from a chair matters enormously. The single worst movement pattern I see in people who keep falling after meals is this. They're resting after eating, lying down or deeply reclined, and when they decide to get up, they try to do it in one fast motion using their abdominal muscles to pull themselves upright from flat. This is dangerous for two reasons. First, it's fast. The blood pressure change happens faster than the body can respond. Second, the abdominal contraction momentarily raises pressure inside the chest in a way that can actually reduce cardiac output for a few seconds. You get a double dip in brain blood flow at exactly the moment you're moving. The safe sequence for getting up from a lying or deeply reclined position is this. First, roll to your left side. Don't try to sit up from flat on your back. Second, let your legs drop off the side of the bed or couch naturally as you use your arms to push yourself up to sitting. Let gravity do the legwork while your arms do the lifting work. Third, once you're sitting at the edge, stop. Don't stand yet. Sit for at least 10 to 15 seconds. Flex your ankles, pump them up and down 20 times. This activates the calf muscles, which act as a second pump for venous blood return. Make fists with both hands and release. Get the circulation moving before you add the challenge of standing. Fourth, when you stand, hold on. The arm of the couch, the edge of the table, a wall. Not because you expect to fall, but because if dizziness does arrive, you have something to find without having to look for it. Fifth, once standing, pause again. 5 seconds. Check yourself. Any gray in the vision? Any leg heaviness? If yes, leg squeeze, fist squeeze, wait. If no, then walk. This sequence adds maybe 20 seconds to getting up. For someone in their 60s or 70s, those 20 seconds could represent the difference between maintaining independence and a hip fracture that requires months of rehabilitation and changes every aspect of their daily life. The CDC data on hip fractures are worth sitting with for a moment. In adults over 65, the 1-year mortality rate after a hip fracture is approximately 20 to 30%. Not from the fracture itself, bones can be repaired, but from what happens while someone is immobilized, pneumonia, blood clots, muscle loss, infections. The body at that age does not tolerate prolonged inactivity well. And the fracture that starts, it almost never happens in a dramatic accident. It happens in a kitchen, in a hallway, 3 steps from the chair someone just stood up from. Standing up slowly after a meal is not overly cautious. It is the biologically correct response to a body that after 60 has a different response time. The brain cleaning window, why your sleep position after 60 is more important than you think. I want to spend some time on something that connects to this conversation in a way that surprised even me when I first encountered the research. Your brain has a cleaning system. It runs at night while you sleep. And how well it runs depends significantly on how you sleep. During the day, your brain is running constantly, processing, moving, thinking, managing every system in your body. That activity produces waste products, metabolic byproducts. And among those byproducts are proteins, beta amyloid, and tau that when they accumulate over years and decades are associated with the development of Alzheimer's disease. Your brain has a system for clearing those proteins. It's called the glymphatic system, named for its resemblance to the lymphatic system that clears waste from the rest of your body, but specific to the brain. During deep sleep, the cells of the brain actually shrink slightly, their volume decreases by roughly half, and the spaces between them widen. A clear fluid, cerebrospinal fluid, then flows through those widened spaces and sweeps the accumulated waste out. This is not a metaphor. This is actual, observed biology established through research at NIH and the University of Rochester. The brain physically makes room for cleaning during deep sleep, and the cleaning happens during the night because those cellular changes only occur during deep, slow wave sleep. Here's the part I want you to focus on. Research published in the Journal of Neuroscience found that the position you sleep in affects how efficiently that cerebrospinal fluid clears waste from the brain. Specifically, sleeping on your side lateral position was associated with approximately 20 to 25% better glymphatic clearance than sleeping on your back or stomach. Why? Because in lateral position, the drainage pathways align differently. The geometry of the skull and the channels through which cerebrospinal fluid flows means that lying on your side creates better flow dynamics for the cleaning fluid. The waste clears faster and more completely. This is the same left side position that helps with post-meal rest. The position that protects against reflux, the position that now research suggests also optimizes the brain's overnight cleaning. One position, 3 separate benefits. I realize this sounds almost too convenient, but this is what the research currently supports. One position, three separate protective mechanisms, left side slightly inclined. For most adults over 60, sleeping on your left side provides better blood flow to the brain during rest, protects against reflux, and optimizes the lymphatic system's ability to clear the proteins associated with dementia. That's not a coincidence. That's biology, working in the same direction across multiple systems in a position that costs nothing to adopt tonight. Now, the lymphatic system needs deep sleep to work. And deep sleep is the exact type of sleep that decreases with age. In your 20s, deep sleep might make up 20 to 25% of your total sleep time. In your 60s and 70s, that can drop to 5 to 10%. Fewer hours of cleaning in a brain that has been accumulating metabolic waste for decades, more than it did at 20. This is why the practices around sleep matter so much more after 60, not less. Here is what helps deepen sleep. A warm shower or bath 1 to 2 hours before bed, not right before and never right after a large meal or while post-meal. Blood pressure is still variable. The warm water raises skin temperature. When you dry off and cool down in the following hour, your core body temperature drops, and that drop signals the brain to initiate deep sleep. Timing matters. The temperature drop happens about an hour after the bath. So if you bathe at 9, you want to be in bed around 10. A cool, dark room, core body temperature needs to fall to enter deep sleep. A bedroom that's too warm keeps core temperature elevated and keeps you in lighter sleep stages. A consistent wake time. This is more important than a consistent bedtime. Your body's internal clock uses your wake time as its anchor. If you wake at the same time every day, your sleep pressure builds predictably and your deep sleep stages concentrate where they should. Variable wake times fragment the architecture of your sleep across the week. Eating your last meal at least 3 hours before bed. A full stomach requires your body to maintain digestive activity while you're trying to sleep. Digestion and deep sleep compete. Ending dinner 3 hours before you lie down gives your body time to complete the digestive process and redirect resources to overnight repair and cleaning. These practices, taken together, don't just improve how rested you feel the next day. Over years, they affect how well your brain clears the proteins that contribute to cognitive decline. Sleep hygiene at this stage of life is not a quality of life nicety. It is a direct investment in the long-term health of your brain. Putting it together, your 7-step post-meal protocol. Let me bring everything together into a practical framework you can use after every meal, starting today. This is not a complicated program. It's a sequence that takes about 20 minutes and protects 3 separate systems: your blood pressure, your airway, and your brain. Step 1. Before you eat, drink a full glass of water. Not a few sips. A full glass, 12 to 16 ounces, drunk deliberately in the few minutes before you sit down. If your doctor's told you to limit fluids, ask about this specifically. For most people, this one habit alone will reduce post-meal dizziness. Step 2, eat more slowly and more deliberately than feels natural. Smaller bites, full swallow before the next bite, no talking with food in your mouth, chin slightly tucked when you swallow. These small adjustments protect your airway on every single swallow. Step 3, after eating, don't rush to clean up. Sit for 5 to 10 minutes. Let the initial blood pressure adjustment happen before you add the challenge of standing. Step 4, when you do stand up, do it in stages. Push back from the table, pause sitting upright for 10 to 15 seconds, flex your ankles 20 times, make fists. Then stand while holding onto something. Pause again for 5 seconds before you take your first step. Step 5, If you experience dizziness at any point during standing, use the leg squeeze immediately. Cross your feet, tighten your thighs, glutes, and core, make fists. Hold for 20 to 30 seconds. If dizziness is severe, lower yourself to the floor and put your legs up. Step 6. After a larger meal, especially lunch or dinner, rest for 15 to 20 minutes in the left side elevated position, supported by cushions so your upper body's at roughly a 30 to 45-degree angle. This manages blood pressure, protects against reflux, and rests your body in the window when it's most vulnerable. Step 7. At night, brush your teeth and tongue before bed. This protects against aspiration pneumonia. Sleep on your left side when possible. Keep your room cool. Go to bed and wake up at consistent times. That's it. 7 steps. None of them require equipment or a gym or a prescription. They require understanding what your body is doing in the minutes after you eat and working with that biology rather than ignoring it. What these signs might mean, the triage ladder, I want to be careful here because I've talked about several symptoms that can overlap with other conditions. Let me give you the clearest possible guide to what to do depending on what you're experiencing. If you have mild dizziness after meals that resolves within 30 seconds to a minute when you sit or lie down, this is likely postprandial hypotension. Monitor it for 1 week. Note whether it happens after every meal or only after certain types of meals. Use the pre-meal water, the standing up sequence, and the resting position. If it improves, you've identified the problem and addressed it. If it doesn't improve, or if it's happening multiple times daily, bring it to your primary care doctor. Ask specifically about postprandial hypotension and your blood pressure medications. If dizziness is severe vision, going fully black, legs giving out, inability to stand, or if it happens when you haven't eaten, that is a different category. Go to urgent care the same day. Not an emergency necessarily, but not something to sleep on. If you experience sudden one-sided weakness, slurred speech, sudden severe headache, facial drooping, or loss of coordination, that is a stroke until proven otherwise, call 911 immediately. Do not drive yourself. Time is directly brain tissue in a stroke. The medical community uses the phrase time is brain for a reason. An ambulance begins assessment and treatment on the way to the hospital. Minutes genuinely matter here. If you have a persistent dry cough that started or worsened around meals, or if you've noticed any of the swallowing changes I described, bring this to your doctor at your next scheduled appointment, or sooner if you also have fever, which could indicate an existing infection. A swallowing evaluation is straightforward and non-invasive, and identifying a problem early makes it significantly easier to manage. If you've had a fall in the past year, even one that didn't result in injury, mention it to your doctor. One fall significantly predicts the risk of another fall. It is not something to be embarrassed about or to minimize. It is clinical information that your doctor needs to have. And there are straightforward assessments and interventions that can reduce your risk of falling again. The goal isn't to make you afraid of eating. The goal is to make the 30 minutes after every meal a window you understand and manage, rather than a window where risks you don't know about accumulate quietly. The recap, if you take nothing else from this video, take this. Your body sends 3 signals after a meal. Post-meal dizziness tells you blood is shifting away from your brain during digestion. Lie down the right way, drink water before you eat, stand up in stages. A persistent cough or throat clearing after meals tells you your swallowing system is showing its age. Slow down, tuck your chin, clean your mouth before bed. Leg weakness when standing tells you your circulation is running a beat behind. Squeeze your muscles, hold on to something, take 20 seconds to get up. None of these are signs of catastrophe. All of them are signals worth knowing how to read. The people who stay on their feet, stay in their own homes, stay able to drive themselves to the grandkids' soccer game, they are almost always the people who learned to notice these patterns early, not because they were lucky, because they paid attention to what their body was trying to say before it had to say it louder. You don't need to change everything. Start with one meal. Drink the water first. Sit for a few minutes before you stand. Notice what changes, small and consistent, repeated for months and years, is what actually moves the needle. Not dramatic overhauls, not perfect execution, just showing up to your own health after every meal, a little more aware than you were before. If you found this useful, the next video covers the signals your legs give you about your circulation, 8 specific signs you can check right now without any equipment that tell you whether blood is flowing the way it should. It's worth watching. I'll see you in the next one.